Okay, this topic of this video is community spread of COVID-19 in the United States of America. I've heard and seen some things go on today that I want to clarify for everybody. First and foremost, and it's February 25th, go to the CDC website yourself. We have tested 426 people in the United States, period. To qualify for one of those tests, you had to be one of the evacuees, or you had to be from Hubei province of China with fever and cough or symptoms of coronavirus, or you had to be from mainland China with symptoms consistent with coronavirus that required hospitalization, or you had to be a close contact of a confirmed case to be tested. Period. Those are the only things. You cannot go into a hospital anywhere in America right now with symptoms of the virus and answered no to travel to China or contact with people who have been to China and get a test for COVID-19. So when you hear Azar, the head of the coronavirus task force, saying very politically correctly that we only have 14 reported cases in America, we have no reports of community spread in America. That's because we have not tested the community in America, okay? And as I said, like a week ago, and I made a video, and a lot of these dots weren't here, and the ones that were here were very small. This would march across the world, and by mid-March, it would be very apparent that it was everywhere. And as you can see, it's happening just like that because it's a very contagious illness. It's also more deadly than Spanish flu was. Our government stood on the stage this evening, and the head of the National Institutes of Health told us that. He said, seasonal flu, 0.1%. Pandemic influenza is about 0.6%. Spanish flu was about 1.5 to 2% mortality. And based on the study for this, we have a mortality rate of 1.9 to 2.6%, making it, more deadly than Spanish flu. So, we don't have any reported cases in our community because we haven't tested them. When are we going to start testing for them? Sometime in the next 2 weeks, they'll roll out the program, they said. It'll roll out in New York, LA, San Francisco, Seattle, and Chicago. I guarantee out of the tens of thousands of travelers we've had since the beginning of this outbreak, from the areas of the big red dots, that cases made it into America, and we didn't catch it. And it's community spreading, not everywhere, but here and there, small scale pockets, big old pockets, we don't know. It's the middle of flu season. If you come into a hospital and you die of viral pneumonia in your 80s right now in America, or you die of pneumonia this time of year from some type of virus, you're not getting tested for COVID-19. You're being counted as, just another death of a regular American cold and flu season, because we have tens of thousands of deaths from flu every year. So what does this mean for us? It means sometime in the next 2 weeks, those 5 sites will go live with their surveillance program, which means if people in those cities test negative for flu, their test results will then be run for COVID-19. Or the name of the actual virus is SARS coronavirus type 2. The disease it causes when you're sick with it is you have COVID-19, if that makes sense. So over the next 2 weeks, they'll roll out the program. They'll start testing those with flu-like symptoms who are negative for flu. They'll run them for coronavirus. When that happens, the pockets and clusters will appear. We don't know yet how bad it's going to be. Just like the CDC said today, it could be really bad. They said to contact your children in school and find out what the plan is. To plan what you're going to do if the daycare's closed. Can you telecommute to your job? If you cannot telecommute to your job right now, save your income tax return. Do not blow it on silly stuff. Save it. because you don't know if when they start doing these community tests, it's going to go like it went in Italy. People went to bed at night hearing rumors of a case in their area and woke up the next morning under quarantine and told to stay in their homes. Do you have enough toilet paper to stay in your home for 30 to 90 days? Cat food, dog food, human food? Do you have your basic essentials, enough shampoo, enough soap, toothpaste to last you 30 to 90 days in your home? Even if all you can afford is ramen noodles, you better stock up on some ramen noodles because, the fact is that no one can say we have no community spread in America. Neither can anybody say, that every American is infected with the virus. Both would be equally unrealistic. To say that there are no cases and everybody's got it. Those are equally ridiculous because the fact is there's some. And nobody knows until we start the community testing in the next 2 weeks how many that sum is and where they are. And we still won't know that for even longer because we're only starting in those 5 sites. And then we're going to slowly expand the program to include other health departments in other areas. So just think about it now, what you're going to do when they do community tests for this and pockets and clusters come up. It's not going to be every person in America. And I feel bad because for everyone in New York, Chicago, Seattle, San Francisco, and Los Angeles, you're American guinea pigs because once they surveillance test your areas and if they do find pockets of this popping up, the rest of the country, we're going to watch what happens to you to figure out what it's going to look like for us when it happens. The CDC said today it's no longer an if it happens, it's a when it happens. Scenario now in America that we know it's going to happen. We're just not sure where and how bad it is. And I think that they're probably getting really, really concerned at this point about how bad it could be once they start testing. And they're trying to just do their little jumping jacks. Like the CDC is being more straight out and honest. Thank you, CDC, for your utmost honesty to us. That it is no longer an if, it is a when it happens to us. And that, the CDC said we couldn't have caught everybody who came through with the virus. And, that's just the way it is. And we have to be ready. So get ready, be ready, and don't be ignorant and be like, well, Azar says there's no reported cases, outside of the 14. There's no reported community spread when we haven't even tested the community yet. Listen to the CDC when the CDC tells us that expect community spread. They're trying to nicely prepare us for what's going to happen when they do those community tests. They know, that we have pockets of it. And I'm not saying it's widespread all over America yet. No, only God knows that, right? Anybody who tells you that there are 0 cases in America are just as big of a liar as anyone who says that every person in America has it. And you got to remember that. No one can say that. Statistically, it's impossible that we don't have clusters. And the clusters could be 2, 3 generations of infected out from the original source and have no idea that they came in contact with someone who came in contact with someone who went to China or came from Hubei province or came from Milan, Italy in the last week or went to Iran or, no one can say that with any certainty at all. And so just remember that. That's why the government officials will not flat out say, we have absolutely no community spread in America, period. All they will say is we don't have any reported community spread in America. So get ready, mentally, emotionally prepare yourselves, okay, to go through what people are going through in Italy and China and things like, not to the extent of China. Our government won't China us, but Italy is a really good example of what we're going to see, okay? It's a really good example. And as soon as the cases start popping off and the momentum's going to pick up, they're going to start tracing all those contacts. They're going to find all these other cases and all these other cases and trying to figure out who it came from and from when and where and how. And the fact of the matter is, with this virus, we still don't know all the ways it transmits. We don't know if some people are carriers of the virus long term, that because we do have recovered people getting reinfected in China and dying. The reinfection is much worse than the initial infection. They're not building sufficient antibodies. They're getting reinfected. They're having massive heart attacks because the heart tissue is damaged from the drugs they had to use to keep them alive and the virus itself during the first infection. We have people continuously testing positive who are supposed to be recovered for long periods of time. So we still don't know. We still don't know how we get it for sure. We don't know how it works in the body, how long it stays in the body. We do have reports and cases and confirmed studies of asymptomatic transmission happening. People don't know they're sick. 85% of the people who get sick aren't ever going to get sick enough to go to the doctor. 15% are. And out of those, 5% are going to get critically ill. And out of those, 1.9 to 2.6% of them are going to, of everyone that gets it is going to die. So we don't know. We don't know much of anything except for we need to get ready and for them to start community testing, because once they do, we're not going to be these happy little dots anymore. We're going to start looking more like Europe real quick. So hope I didn't burst anybody's bubble. That's just the way of it. And I don't want people confused and having a false sense of security that everything is okay just because the way they're phrasing things, when we've only tested 426 people out of the tens of thousands of people that came to America during the outbreak from all those places. So be safe, be ready, don't panic. Go ahead and get things now while they're on the shelves. I myself am about to head out to Sam's Club to go finish stocking up. I already started. Now I got to finish. I want to be done today because, I don't want to be fighting the crowds as this gets closer. And, anytime more cases could pop up. If a really weird, suspicious, group of deaths occurs in a certain hospital in a certain city or something, they may go ahead and start testing those people there before the main surveillance rolls out. And once they do, things are going to happen fast. Within a matter of hours, things are going to lock down, close, shut down. Orders are going to be given, things like that. So go ahead and get ready while you still have a chance, because you've been warned. And I hope everybody does well, and we will survive this, and we'll continue on. Unfortunately, there will be 1.9 to 2.6% of us that don't, and we're not going to get a vaccine in time. All right, I guess with all that depressing and scary news there, that's all I have to say about that. Like I said, fact check anything I just said, and if you can find anything I just said is not on the CDC websites or isn't in those press conferences or hasn't been in the news, good luck with that. We've also had 4 new countries report cases today: Switzerland, Austria, Croatia, and is it Algeria? Anyway.